Hello, I'm Barbara Cantu. I'm one of the students for Spring 4341. I'd like to thank you for taking a few minutes to observe my summation of our group project, which was an analysis of the Marshfield Clinic. Our group was assigned the Marshfield Clinic Health System in part because of the failed merger attempts in 2019 with the Gunderson Health System. Both of these health systems operate in the state of Wisconsin. To evaluate this facility, our group chose the Porter method and the Porter strategy. We determined that the Porter strategy this facility uses is the low-cost strategy, which is based on having a lean budget, high volume share or market share, and that this strategy becomes a part of your corporate culture. This was evident in some of the competitive forces evaluations. This facility has a long history. They're community-oriented. They operate in a very difficult marketplace of rural Wisconsin, which is a shrinking population and aging population, meaning that they have a tremendously high Medicare population, which of course means lower reimbursements. In 2017, they noted that they had over 3.5 million patient visits, but in 2018, they lost $84 million. They blamed it on ACA. Either way, we determined that this facility is very solvent. They have over $900 million in resources. Let's learn a little bit more about the facility itself. Founded in 1916 by 6 different physicians, they built their first clinic 10 years later and stayed there for 49 total years. 1976 is a pivotal point in the history of this facility. That's when they were first invited by a neighboring community for their first satellite location. That sparked the growth. Through mergers, purchasing of other practices, primary development, they became the largest medical group in the state and have become one of the largest group practices in the United States. Today, they have 55 clinics, 4 hospitals, with 86 specialties, provided by 1,200 physicians, and they employ over 10,000 people in the state of Wisconsin. Part of their growth included a business solutions, which is their corporate health program, a health insurance program, Security Health, a medical research institute, a core laboratory, and an education division, which deals with medical residents. Their mission, however, has always been the same. It's a commitment to the quality of care, meaning the right health care at the right time, a quality to medicine based on the latest scientific research and evidence, and a quality of life, which is their overall quality of life. 2 of the 5 competitive forces here are the power of suppliers and power of buyers. The power of suppliers, this facility has done a fabulous job in limiting the power of suppliers. First off, they consolidated and centralized their warehousing and distribution. They joined a GPO and drilled down in that GPO to find a primary provider within the GPO for better pricing. They have, through their health system, what they call the Systemic Strategic Cost Management Initiative. Those are teams in subspecialties of physicians, administrators, managers, and materials management where they take data, opinions, and evaluations and systemize or customize a systemic use of one product, whether it is syringes or catheters or a particular something for the OR. And the entire system uses it. If they cannot find the best price within their GPO, they're not afraid to go and find another supplier to get them the best price. For the power of buyers, it's another area that they've done very well in. PPOs can be challenging for any medical group, of course. They do have their own health plans. Of course, other health plans can be an area sometimes where buyers have power, but the facility's done very well at keeping a good balance on that. The area that they have to be most concerned with is patient satisfaction scores. Keep in mind that they operate in small towns where people talk. Happy people come back. Upset people go to other places. And now CMS, of course, pays in part by patient satisfaction. So that's one of the important things that they need to observe and be conscientious of going forward. 2 of the other competitive 5 forces is the existing competitors and the threat of new entrants. They deal with their competitors in a very interesting way. A couple of examples here. The Beaver Dam Community Hospital System had LTACs, long-term care facilities, a couple of hospitals. They were bleeding money, and Marshfield Clinic just came and purchased them. Ascension, Wisconsin is the 2nd largest medical community in the state. They backed them into a corner in one town and said, sell the St. Joseph Hospital, or we're going to go across town and build a bigger and better one and take all of your business. Ascension caved. They sold them the hospital. It's one of the 4 hospitals they own now. And then, of course, they have the smaller competitors such as Aspirus. The threat of new entrants is very, very low. Of course, there is always great rivalry in healthcare. We know that. And the domination for one company to dominate in healthcare is very, very uncommon. So this is where the long history becomes a benefit for these. The threat of new entrants is very low. The substitute products I found very interesting. Currently, the mega chain Walmart is putting in clinics, and this is something that the Marshfield Clinic should be aware of. They already offer pharmacy, optometry, and dental in some locations. Walmart has begun putting in clinics for non-emergent physician visits. They have full lab and radiology. They put their prices right on the website, so patients can check it out. This is not a brand new philosophy. HEB in Texas has the Ready clinics for non-emergent or primary care services. They also have a pharmacy. Target has partnered with CVS. Something else that is not in Wisconsin yet, but could be a substitute product later on, is the freestanding ER centers. The product that they should be most concerned about and observant on is the telehealth programs. This is something that they offer for their corporate clients, but telehealth is definitely gaining momentum, as we have learned over these last couple of weeks with these shelter-in-place and pandemics. It is an acceptable way to practice non-emergent medicine. Walmart, Walgreens, CVS, and Apple have all indicated that they are interested in entering to this marketplace. Why? Low overhead and high possibility of an ROI. Our recommendations for the Marshfield Clinic, we kept it to 3. They should standardize through their EHR platform throughout the health system. One, as large as they are, they can negotiate a good rate for a standardized EHR. Take out the bits and pieces and trying to mishmash. It will eliminate mistakes, resulting in better patient care, higher patient satisfaction, possibly assisting in future litigation. We just think that this is one of the things that a facility that large should have already addressed. Secondary, they should expand their health plan in very specific areas to meet the needs of new patients. There's too many uninsured people in the state of Wisconsin. That is definitely an area of growth. That the expansion of their telehealth services is currently offered by their Business Solutions division for their corporate clients, but it's not available for their private care patients. We feel that this is an area that they could definitely expand, and low cost, and could be a high ROI, especially during times like harsh winters, or as we're seeing now with the pandemic. Our conclusion: this facility has a long, successful history of over 100 years. They have been very proactive and successful in addressing the 5 factors of the Porter Method. They're not the largest system in Wisconsin, but they are consistent, and they've maintained a large portion of their market share. They are the largest medical group, as I said, in the states. While they're at low level risk for new entrants, they should pay attention to the 3 areas that we indicated in our recommendations, especially the telehealth services. In the future, they need to pay close attention to new competitors. It is our consensus that although the merger failed with Gunderson, that it was not detrimental to either health system and shouldn't affect Marshfield negatively at all in the future. In fact, we believe that this facility will continue to be very successful. I thank you for your time and attention and wish you a good day.